Um, I keep telling you guys I'm going to do this, and then I keep doing other things instead of what I say I'm going to do. So I'm going to give you a quick rundown on postpartum, then I'm going to do a high-risk postpartum, then a newborn, and a high-risk newborn. And it'll be 4 separate videos, but I promise you they won't be long. I'm going to click through this quick. I know we've talked a lot about postpartum, but I just want to make sure you have this as a reference if you needed to go back. So really, some of the things where you think about what is postpartum, first of all? Postpartum is that 4th stage of labor, right? Postpartum is the recovery period after someone has a baby. So typically 2 days people stay in the hospital for vaginal delivery, 3 to 4. And we really look at the postpartum period really for about 6 weeks is typically what we think of as postpartum. Some people even say it's another trimester, so it's another 3 months. It kind of depends when you talk with people. But 6 weeks, at that 6-week checkup is where they go back to the doctor and they look to make sure that the cervix is closed back up and all of the vaginal tissue has healed and that they're no longer bleeding and there's no signs of infection. And that's when people can get the go-ahead to have intercourse again. So anyways, we're kind of looking at those first 6 weeks. So involution is as the uterus goes down. So remember 0, 0, if we look 2 weeks after childbirth, you really shouldn't be able to feel it at all. But at day 1, you're at 0, 0 is what we call it, right? So you're at, I'm sorry, you're not at 0, 0. You're at UU, right? So the uterus is at the umbilical. UU, I don't know why I said 0, 0. UU. If it's above it, it's going to be 1 over U or 2 over U. If it's above it, it shouldn't be. It really should be at the umbilicus after delivery. So it's above it, or if it's distended to the left or right, you're worried about a full bladder possibly. And then it kind of goes by day 1. It's UU. By day 2, it's going to be 1 to 2 finger breaths under U. So you're going to go U over 2, U over 3, and then you're not even going to be able to feel it anymore because it's going to go back down until the pelvic bone. Your uterus should be hard and firm. It's that whole placental site where all of those blood vessels are what has to heal and ligate off. And if the uterus doesn't stay firm, it can't ligate off those blood vessels, and then you will hemorrhage. So it's really important. What causes the fundus to be firm? Breastfeeding, because it releases oxytocin, IV Pitocin that they can give you. Massage causes it to be firm. Making sure you have an empty bladder, because if your bladder is full, it can cause it not to be able to clamp down. If there's a clot stuck in it, it will cause it to be boggy, or not firm is what we call it, boggy. So sometimes they actually have to go in and express a clot. If there's retained placenta. So the doctor or nurse midwife is going to look at the placenta when it's delivered and make sure all the lobes are there. But sometimes there's pieces. What if someone had sort of a small accreta? Remember, that's when it grows into the walls of the uterus, and they didn't realize it, and there's still some retained parts. That's a uterus that won't clamp down and people keep bleeding. And I know you guys have read about postpartum hemorrhage, but that can be another reason why. So what we call the discharge, so it's not a period, right? It's not menstruation. It's not the lining of the uterus, technically. It's sort of the placental site is what's coming from the placental site is what is your vaginal discharge. So we call it lochia. So instead of like menstrual fluid, it's called lochia. So the first few days, it's rubra. It's bright red. It can have small clots. It can be a little fleshy. It's like tissue and stuff. I don't know how to explain it. If you more than a pad an hour, if there was a foul odor, large clots bigger than an orange, or like a small orange, that's not okay. And then it becomes serosa, where it's more pink. And can pinkish to pinkish and brown. And again, you're going to be looking at foul odor, obviously is never an okay sign. And then for the next couple weeks, you really can have this almost throughout all of postpartum. You have what's called lochia alba, and it's more of a whitish discharge. And again, it's just sort of the serosanguinous fluid and the kind of tissue and stuff coming from that placental site healing. So really, by 2 weeks, people should not be having a lot of pink or red discharge, and if they are, they maybe have done too much and irritated that placental site, and they need to lay down. So this is, we quantify it as scant, light, or moderate, or heavy. Heavy is more than a pad an hour. That's sort of the going rate. If anyone is soaking a pad an hour, that's too much and it needs to be assessed, or large continuous clots. If someone's postpartum at home and they're having moderate bleeding that doesn't lighten up when they lay down, that would also be a concern. So this is why we say for the vagina to kind of all that tissue to get back to where it needs to be can take 6 to 10 weeks. And your perineum can take a while to heal, especially if you had to have an episiotomy or you had any tears. People can have some scar tissue that forms. If they had to have stitches, those will just dissolve. But this is where there's a lot of patient education. And so patient education with using the peri bottle, spraying from front to back after you go to the bathroom, taking sitz baths in a couple inches of warm water when you get home if there's itching, nothing in the vagina, no tampons. Loki is not menstrual fluid. It needs to be in a pad. It can't be in a tampon. That can cause toxic shock. It can cause infection and things like that. Basically knowing that the perineum is going to be swollen or bruised in ice for the first 24 hours. Ibuprofen can help with that as well. And then we always talk with patients once they resume sexual intercourse again, typically not until 6 weeks, and the OB-GYN makes sure everything is okay and healed okay. People will often have a lack of lubrication, especially if they're breastfeeding. And it's just because of how the hormones are, or things can be a little bit different because of scar tissue and whatnot, and scar tissue isn't going to stretch like normal vaginal tissue should stretch, and so it can be painful. And we know that painful intercourse is difficult for everybody, right? It's difficult on the mom, it's difficult on the couple as a whole, and so definitely lubrication is something that we encourage people postpartum to use because it can definitely be a little bit difficult at first. So I had a doctor who would always tell everyone, like, a glass of wine and a tube of lube and you'll be okay. Like, you need to relax a little bit because it can be a little scary to kind of that area is super sensitive. So things that people need to think about. Another thing I always tell patients is you ovulate before you menstruate. So you will ovulate before you have your period. People have shown up for their 6-week checkup pregnant. While nursing suppresses ovulation, we know it doesn't necessarily suppress it enough in everyone, and some people will still ovulate. And if you ovulate and you kick an egg out and you have sex and it's unprotected, boom, you can have a baby before you've ever even had a period. So I have a friend who has Irish twins in that way, and so less than a year, and she never got a period in between. So it can happen. This just talks a little bit about what I talked about. We know there's different degrees of perineal tears. First degree is just a little bit. Second degree is going to go even farther. Third has more of the anal sphincter in it. And fourth goes all the way into the rectal mucosa. The fourth degree needs a massive repair, and that is incredibly uncomfortable. Second and third are rough too. These moms need lots of ice, lots of Colace. We don't want them to have to strain to have a bowel movement and end up somehow, tearing it further. This can be very uncomfortable. Periurethral can be very difficult as well. It's where you tear up towards the urethra. So again, something to, be involved, make sure that using that peri bottle helps a lot. And then really the vaginal wall can be, babies can cause abrasions on the inside of the vaginal walls that just can cause pain. And then the cervix can also be, if you have a lot of bleeding after, you're going to look in the cervix, and sometimes they actually have to go in and stitch the tears in the cervix. The cervix doesn't necessarily heal as like the vaginal wall does. Also, that's where you can have a hematoma on the vaginal wall too. And people who present with a hematoma will have, sometimes they won't bleed because the blood, remember, is in a hematoma, it's collecting on the inside. They will have unrelenting vaginal pain that no medication is touching. And the fundus may feel firm, so you're confused, but they have just unrelenting vaginal pain, and they'll go in. And we've had people have to go to the OR and have 500 cc's evacuated from it. So it can really, they can start to become hypovolemic and tacky, and their blood pressure can drop, and sweaty, and just unrelenting vaginal pain is a sign of that. So again, I just want you guys to read through this, that, we have that 50% increase in plasma volume, blood volume when you are, blood and plasma volume when you're pregnant, and you're going to, because of your placenta being delivered and all those hormones dropping, women sweat a lot postpartum. They'll do a lot of sweating in the end of night, in the middle of the night. You still have the increased clotting factors. That takes a while for your body to go back to normal clotting factors. And remember, you have that increased clotting factors to keep you from hemorrhaging. However, it does put you at risk for a blood clot. So you need to educate women on signs and symptoms of a PE as well as a blood clot. A lot of women are hungry after delivery and they're excited. They certainly can have some constipation, and so we definitely want to, we like them to poop within the first 2 or 3 days, and we definitely give Colace for a while to help keep their stool soft and easier to pass. Really, the biggest thing with urine is that you just want to make sure that they don't have a distended bladder, because it really can keep that uterus from contracting down and can significantly lead to hemorrhage. So again, I think if we've talked about this, but a fundus that is off to the right or left, okay, and is above above the umbilicus, is a sign of a distended bladder. At the first hint of a postpartum hemorrhage, the first thing you're going to do is cat that patient and see what's going on. And if they aren't emptying their bladder completely, which is why we do eyes and O's on moms after delivery. So there's a picture of what that would look like. So people are going to be sore. Their muscles are going to be sore. Sometimes they're surprised. And I always say, it's like you just ran a marathon. Pushing a baby is hard work. You use so many muscles, and you use a lot of muscles you're not used to using. So it's not abnormal for people to just feel very sore afterwards. Diastasis recti is when the abdominal muscles stay separated. You've probably seen this in some people. And there's physical therapy and exercises they can do to bring that back. So here's a picture of diastasis recti. Some people they say 2-finger or 3-finger. It's the amount of fingers you can do in between. So like mine did not separate during pregnancy. Some people's do. It just depends on kind of how your body is made. As your hormone levels go down, your stretch marks will fade. People will often lose hair for a while, for a couple months after delivery, and they'll say with every hairbrush they're losing a bunch of hair. It's because your body held on to a lot of hair while you were pregnant. So it's not necessarily that you're losing hair. People are tired. Anyone who has a headache, could it be a spinal headache? But also, you can have idiopathic preeclampsia. That even though we say preeclampsia, that the cure is delivery, it's the only cure, it can still linger for a week or two after. So that's why that's part of your postpartum discharge instructions, is signs and symptoms of preeclampsia. Again, you ovulate before you menstruate. Your full milk comes in within 2 to 3 days. You guys can read about weight loss. And then really just a lot of bonding and attachment. And one of the things I really want people to keep in mind, that it takes a while to bond with a baby for some people, and that is not abnormal. You will see how babies try to gain attachment, and that helps mom. And I always say when a mom is super anxious, you'll see a baby not necessarily doing a lot of these attachment behaviors, which causes sort of this vicious cycle. And we're going to watch a movie. Once we're done with Hesse, we're going to watch this great movie on postpartum depression, and then actually FaceTime with the producer of it. And we'll talk a lot of times postpartum depression can be related to sort of attachment issues. So one of my favorite nurse theorists, her last name is Rubin. She has this taking in, taking hold, letting go phase. And I have used this. I don't know why they don't put her name in there. They should give her credit. I can't think of her first name, but Rubens is what we always call it. Rubens taking in, taking hold, letting go. And basically what this means is that in the beginning, they really can only focus on themselves. They're thinking about their delivery. They're processing what happened. They're not, and what's so hard is it's during that taking in phase, when they're really just focused on themselves, that we're trying to teach them so much. And that's what can be really challenging. And then taking hold, they start to shift more to their newborn. And then letting go, they start to kind of realize how their life has changed and adjust to it. And so I use this taking in, taking hold, letting go a lot when I talk to postpartum depression moms, that it takes time. But as nurses, we need to think about what phase patients are in. We're in the hospital, and we need to give short instructions. We need to give very specific short instructions. We need to listen to what the moms say. We need to make sure they have I always ask moms to share their stories if they're able to and want to, because they're in the taking in phase. They're focused on themselves. They're processing what happened to them. This is natural. You have to process when major things happen to you in your life. So they need to process. And so really one of the best things you can do as a postpartum nurse is just to say, tell me your birth story, and make sure everyone realizes their story has such value no matter what it is. I mean, you guys can read things that can affect adaptation. Postpartum blues is totally normal. If you don't have postpartum blues, you're actually abnormal, because up to 80% of moms will have this. It's a little bit like PMS kinds of feelings. It's as those hormones start to drop, and you've had this huge excitement, and then you've had a huge adrenaline rush, and then it just crashes right as you go home with a newborn. And so these moms can just feel sort of melancholy, a little bit sad. confused as to why maybe they don't feel as happy as they thought they would. However, these moms are typically able to eat and sleep and take care of their baby, but they just kind of have this like nagging melancholy. And they'll tearful, very similar to PMS, just emotions are raw and on the surface. But the wonderful thing about postpartum blues is for most moms, it does lift. 20% of moms will suffer from what we call perinatal mood disorders, so postpartum depression and actually anxiety. And then 1% will have postpartum psychosis. And I'm going to talk about that when I go into the next slides. So I'm going to go ahead and finish this one. And then, oh my gosh, I forgot how to finish them again. What? How the heck do I turn it off? Oh my gosh, you guys, right when I think I'm getting good.